Welcome, everyone. Thank you so much for joining us here today. We're going to hold on just a second while our platform's letting everyone in. In the meantime, you're more than welcome to use the chat box to say hello. Let us know where you're tuning in from today. We would love to hear from you. We'll get started in just a minute. As you're entering, you'll notice that your mics are automatically muted, your cameras are off. It will stay that way throughout our session today, but we encourage you to use the chat to communicate throughout our session. So feel free to hop in there, give us a greeting, and again, let us know where you're joining from. Oh, wonderful. I see those coming through. Hi, everyone. It looks like we have folks from all over, so it is great to see you all. And of course, happy Mental Health Awareness Month. We are so grateful to have you all joining us here today. I know our numbers are still growing a little bit, but I'm going to go ahead and get us started for our session today. Thank you so much for joining us and welcome to today's webinar, Hoarding Essentials, What to Know and How to Help. My name is Jackie Zimmerman. I'm the Public Education Associate at Mental Health America's National Office, and I'll be moderating today's session. I have just a few notes for you before I introduce our speakers for today. This webinar is being recorded and will be emailed out to registrants within 1 week. We currently do not offer CEUs, but if you would like to request a certificate of attendance, you can do so by filling out a form. I'll put the link to that in the chat here shortly, and that will also be included in your follow-up email. We should have some time for Q&A at the end with our speakers today, so feel free to be asking your questions in the chat throughout the session, and I'll be collecting those and we'll have some time to go through them at the end. We want to make note that May is Mental Health Awareness Month, and this May, MHA is challenging you to examine your world around you and how it can affect your mental health. Our campaign this month is Look Around and Look Within, and we're exploring all the ways our neighborhoods, genetics, and many factors come into play when it comes to our mental health and what our environment has a play in that. This specific week, we've been talking about home environments and how to have a healthy home environment that's supportive and conducive to promoting good mental health, which is really what brought us to bring this topic to you all today, to really discuss and take a look at hoarding disorders and how those can affect individuals, how loved ones can help support someone going through this, and really take a dive in for the next hour. So I would love to introduce our two wonderful speakers we have joining us today. We have Suzanne Odie and Elizabeth Barr. Suzanne is a clinical social worker who provides therapeutic support to clients who experience a range of mental health challenges, including hoarding disorder. As a Master of Social Work student at Boston University School of Social Work, Suzanne joined a team of research scholars who studied compulsive hoarding and received training to lead CBT-based group and individual treatment. Following her studies, she continued to collaborate with the BU team while delivering presentations to the community, leading treatment groups, and writing about hoarding disorder. In addition to hoarding-related work, Suzanne lectures at BU, maintains a private practice, and facilitates equine-assisted mental health programs. Welcome, Suzanne. We're really grateful to have you joining us.
Thank you. Nice to be here.
Absolutely. And with us, we also have Elizabeth Barr, who's a peer counselor at Mental Health Association San Francisco, MHASF, who brings her own experiences with hoarding disorder to her peer work. She's a presenter, research assistant for Better Treatments for Hoarding Disorder, and a one-to-one peer counselor. At MHASF, Elizabeth facilitates buried treasure classes, advanced drop-in group, and family and friends support groups. Welcome, Elizabeth. We're really grateful to have both of you here joining us.
Thrilled to be here. Welcome, everyone.
Thank you. Thank you. So today we're going to start off by hearing from Suzanne a little bit about what hoarding disorder is, what it looks like, how it affects individuals, how loved ones can support someone or identify that someone might be struggling with this. And then we're also going to hear from Elizabeth on her perspective and really lived experience with this. So with that, I will hand it over to Suzanne.
Wonderful. And I will share my screen so we can take a look at my slides. All right. I assume you can all see my
Looks
slide.
great.
Great. Wonderful. Thank you. Thanks, Jackie, for your kind introduction. And it's wonderful to be here with everyone today. So today we are going to, as you heard, be covering hoarding as a mental health challenge, talking about some of the strategies and skills to assess hoarding disorder, taking steps to assist people who hoard, and then we'll talk a bit about some community-based hoarding resources that may be helpful. So when we think about hoarding, it's important to take a systems perspective and to recognize that hoarding disorder not only impacts the person who's living it, so that orange dot in the middle, but that hoarding extends and intersects with a multitude of organizations that a person who hoards may interact with. So this can be municipal organizations, friends, families, and neighbors, mental health providers, and service-related providers. So there is quite a span of influence around the issue of hoarding. So an important takeaway for today is to really remember that hoarding disorder is a highly stigmatized problem, and it's often presented as the problem of an individual. So sometimes in the shows that you've seen on TV or when people talk about hoarding, people are portrayed as the ones who are willfully cluttering and perpetuating hoarding. And the term hoarders projects the idea that the person is the problem, when in fact hoarding disorder is a mental health disorder. And so we need to be mindful of how we talk about hoarding and how we may be perpetuating stigma by calling people hoarders. We need to watch our language as we talk about hoarding. So some of the primary ways that hoarding shows up are demonstrated here in this picture by acquisition, so acquiring items and more items, saving those items, and then the disorganization that exists amongst those items can manifest clutter. And some of you may be familiar with the DSM-5. There is criteria for hoarding disorder. In 2013, the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, defined hoarding disorder as a diagnosable condition independent of OCD. Prior to 2013, there was thought that it had been connected to OCD, and it was listed as diagnostic criteria for obsessive compulsive personality disorder. There are 6 criteria and multiple specifiers that relate to insight levels, acquisition behavior, and here you can see some of the points of definition that the DSM-5 describes hoarding disorder as. So persistent difficulty with discarding. The difficulty is due to a perceived need to save items. There's high levels of distress associated with discarding items. Symptoms can result in an accumulation of possessions that congest and clutter active living spaces and really compromises the intended use of those spaces. Hoarding can cause clinically significant distress, impairment in social, occupational, and other important areas of function. And we also note here that the maintenance of a safe environment for oneself or others can be compromised. Hoarding is not attributable to other medical conditions, such as a brain injury, and that we don't account for hoarding through other symptoms within the DSM-5, such as obsessions through obsessive compulsive disorder or decreased energy in major depressive disorder, and so on. And the specifiers I mentioned earlier, we specify if there's an excessive amount of acquisition and the insight level that the person has with regard to their items, whether they have good or fair insight into the hoarding related beliefs and behaviors they may have, through absence of insight, so delusional beliefs about clutter, and that the person may be convinced that their hoarding related beliefs and behaviors are not problematic despite evidence to the contrary. I often am asked the question, what is the difference between collecting and hoarding? And this chart outlines some of the features and compares collecting and hoarding. For example, with acquisition, collectors often plan their searches and they limit what they acquire, and generally they purchase items, versus those who may be hoarding, they may not have a plan to their acquisition, and often they will acquire excessive amounts of items, and many times these items are acquired freely, or they buy items as well. Also, the distress level. So with collectors, usually collecting is very pleasurable. Rarely there's financial distress related to the acquisition, whereas people who may be hoarding, they're having distress from their clutter and the items that they're acquiring. They are not discarding, and there's distress around not acquiring. So there's some important differences here that you can see between collecting and hoarding. In terms of prevalence, if we look at the US prevalence for hoarding disorder, it's about 5% based on the research that we have. And you'll see some similar numbers around Western Europe. With a current population of over 300 million people in the US, we do the math and there's about 6.64 million people, or 5% of the population, who are impacted by hoarding. So as you can see from these numbers, hoarding is a global issue and it shows up across lines of geography. It's not uniquely an American concern. The age of onset of hoarding starts quite young. So it starts between the ages of 11 and 15. However, people tend not to seek help for it until later in life, when they've had years to acquire and collect items. And generally 11 to 15-year-olds, their environments and their homes are regulated by their guardians and their parents. So they may not have the opportunity to acquire and to collect in such a way that they create a hoarded situation in their living space. We know that there are a number of mental health disorders that may accompany hoarding disorder, and the most prevalent is major depressive disorder. About half of the people who experience hoarding disorder also experience symptoms of major depression. And as you can see from the chart, there's a range: general anxiety, seasonal affective disorder, ADHD, OCD, and PTSD. So hoarding does not appear to be an issue independent of other mental health disorders. There are also medical problems that can show up amongst people who hoard. And as you can see here, over 60% of folks who are hoarding endorse at least one chronic and severe medical condition. And that goes up, the number goes up substantially for older adults with hoarding disorder. So there's certainly a need for comprehensive health care and targeting of hoarding symptoms that may be a barrier to one's medical wellness and care. There can also be social and functioning problems that occur. People who hoard may be socially isolated. There may be strains in relationships with families and friends and landlords, neighbors, legal financial problems, as well as work problems. So this is a problem that really impacts individuals on any number of levels. It's also important to note the family burden that hoarding can create. So folks who grow up in a hoarded household, they may be embarrassed about their home. They may not invite friends over to visit. There's an increased strain in the relationship with the parent or parents who may be cluttering. And that generally there's less happy childhoods for folks who are living amongst a high level of clutter in a hoarded environment. There can also be issues of rejection and isolation that result as a hoarding problem develops within a household. And most importantly, there are problems affecting safety in the home. And when we talk about intervention for hoarding, we often take the approach of harm reduction. Michael Tompkins, who's a noted researcher in this area, writes about harm reduction, and he has published widely about taking the approach of looking at keeping a home safe. So not going for necessarily house beautiful and aesthetics and such, but more, are there fire hazards in the house? Are conditions in the home sanitary? If there was an emergency in the home, could medical personnel come in and assist the person who's in that environment? Structural damage, all sorts of concerns exist within hoarded homes. So it's very important to consider those when you're assisting someone. And this is a model, it's talked about in the research. It's something that you can read a bit more about independently, but it summarizes the inputs that result in the output of clutter. So there are vulnerabilities, perhaps a family history of hoarding, the comorbid mental health concerns that we talked about earlier. Some of the core beliefs about one's possessions can be a vulnerability. Couple that with problems processing information. So folks may experience ADHD or have significant problems with decision making or problem solving. These contribute to the beliefs and the meaning of possessions that one has. So how a person is attached to their items, may identify with and through their items, or perhaps feel that they will lose a particular memory or will lose track of things if they're not in their sight line. So having control over one's possessions is an important marker for this. This can then elicit negative emotions and positive emotions around clutter. So people can feel quite joyous and happy about their collections and their clutter, but can also feel some of the negative implications that the environment may create. And so there's negative and positive reinforcement that happens. So the positive reinforcement may be taking pleasure in acquiring, whereas the negative reinforcement may come in acquiring to avoid or escape bad feelings. So the saving and acquiring increases and thus the clutter increases. So some of the strategies and skills we use to assess hoarding disorder, I like to show this image first. It is one of an iceberg, as you can see. And you see above the waterline, there are very obvious things that you can see, the saving, the acquisition, and below that are issues of mental health, physical health, executive functioning. Often folks who hoard have experienced trauma and loss. There can be family history and neurobiological symptoms and so on. So there's a lot to consider beneath what we see above the waterline. When we're assessing a hoarding problem, we have some general questions that we may ask, such as, has other people expressed concern about the volume of possession in your home? Or are there challenges within the home? Are things working as they should? And may look for signs of hoarding, such as carrying overstuffed bags with many objects in them. Perhaps there may be personal hygiene issues, or people may be collecting a lot of free things. So these are just some general observations and questions to consider. This is a list of some of the hoarding assessments that are used, and you can read more into what these assessments look like and how they're administered. But for purposes of time today, we can't do a deep dive into each of them. But this does summarize some of the questions that are asked through an interview format. The second band of assessments are things that either a person who's hoarding may report on, or someone who's assessing, such as a clinician, or even perhaps a friend or family member. There are self-reporting assessments, as well as an assessment for children who are saving, so parents who may report on their child saving. There's also a hoarding interview, which the goal of the interview is to understand why items being saved are important to a resident, to a friend, someone who's hoarding, where the items are being acquired, what are the perspectives and desires of the person who is doing the saving and the cluttering behavior. And some of the questions here as examples help engage someone in a conversation about why particular items are important, their experience with clutter, if there was a time that the person may have felt like they've successfully organized their space. So again, really opening the conversation about the items and the collection of things that the person may have. The clutter image rating is an image rating that we use as clinicians and providers that is one that is visual. And you'll see in the next few slides, we use imagery to compare a space that we may be assessing with sort of a standard set of numbers and representative pictures of a space. So here you can see this is one particular set of images that you may liken the clutter that you are looking at with a particular number. This is one for a bedroom. You can see number 1 is uncluttered through 9 is heavily cluttered. This is an example of a client space that we might work within. So we may use the clutter image rating to assign a number to a space. The benefit of working with this model is that it helps standardize clutter load. So it helps providers understand, if you're working in collaboration with others, you reach a consensus or a consistent understanding of what you're looking at in an environment. There is a clutter image rating mobile app that my colleague at Boston University, Jordana Muroff, worked on with her peers, and it's downloadable from the App Store. It's something that you can have in hand if you're in a space, and you can readily access the photos and the numbers to assess the space that you're looking at. So again, assessing risk is a very important aspect of our work when we're looking at a space, certainly looking for safety issues, condition of the home, and here we list a few of the assessments that can address that. We also look at activities of daily living. So is the person in their space completing things such as food preparation or moving about the home, using the bathroom, and being able to exit the home quickly. These are all important aspects to consider. This is another assessment, the HOMES assessment, that assesses issues of health, obstacles in the home, mental health issues, endangerment aspects, as well as structural and safety points within the home. And again, the Home Environment Index, which I alluded to, which addresses measures within the home related to perhaps squalor or insect infestation or moldy or rotten food. And again, the activities of daily living here. And another example of a space where we may use some of these assessments to help understand and create a plan to assist someone who lives in a hoarded space. So the big question is, what steps can we take to assist someone who is hoarding? There's a number of considerations we have to think about. Certainly the level of risk, as we talked about earlier, support services that may be available, really the willingness of the person to engage with those support services, and what is available in our community. What do we have access to enlist some help? There are a range of approaches to what help may look like. So harm reduction, as I mentioned before, looking for code violations and safety issues within the home, and taking the approach that we want to create a safe environment. Enhancing the motivation of the person who is living in the clutter, and helping them set some goals and visualize how their space could be different. Case management and in-home coaching can happen with housing professionals, social workers, and other perhaps home organizers who have been educated about hoarding. The specialized cognitive behavioral treatment for hoarding is something that I'm engaged in. So this is an approach that's been researched and involves sorting and discarding activities, teaching clients or people to organize and learn how to build those skills, and also delves into understanding the motivation, the beliefs, the thoughts that people have about their items. A supported clean out is one working with the client or the person to clean their space. We tend to avoid a forced clean out unless it is a significant issue of health and safety. And generally there are multiple entities who are involved with that sort of approach. Support groups and family consultation are other ways also to gain some help around these issues. And as I mentioned earlier, we tend to avoid what is called a forced clean out. And this research shows that there's generally no change after that happens. People tend to go back to cluttering, and the problem then continues. There's not sustainable change created. So again, the CBT approach for hoarding, this is something that you can read about online. I'll certainly send some resources along to point you in the direction of some publications and some websites that can elaborate on CBT relative to hoarding disorder. The good news with this approach is that the reduction in clutter is quite significant over time. So the SIR, which is the Saving Inventory Revised measurement, measures the person's level of difficulty with discarding, with clutter, and with excessive acquisition. And these things have all improved across the course of this almost decade of studies that we see here. And here is a list of some of the cognitive techniques that we use to evaluate the beliefs of the person. So looking at some of the hoarding related beliefs, such as a person may feel very responsible for their objects. They may feel that their objects represent their personal identity, such as they're an artist or they're a problem solver or and the like, a teacher perhaps. Some of the unhelpful patterns that we look at in cognitive errors are the ideas of discounting the positive, jumping to conclusions, overgeneralizing. You know, for example, if I let go of this collection of books, I'll never have the same collection again, or I'll never be able to access this information. So there are unhelpful patterns that we take a look at and we challenge through a CBT approach. Motivation, of course, is central to the work that we do. And so, of course, there is usually, if not always, some ambivalence to entering treatment for hoarding disorder, but really keeping motivation at the forefront and keeping the idea that the importance of change is essential, as well as the belief that change is possible is an essential part of the work. As helpers, we want to remember to express empathy even when we may be frustrated or struggling to understand the why. Why is the clutter happening? Why is this person continuing to acquire when they know there's a clutter problem? So empathy, again, plays a central role as well as motivation. Establishing the values and the goals of the person, right? So keeping not only their concerns, but also what's important to them. What are we working toward? How do we work together to partner to make these things possible? Generally, we want to avoid terms like hoarders and junk. We want to carefully listen to what's said about the meaning of the possessions of the person. Collaborate on decision rules, whether you choose to acquire or keep or discard something. Remember that the person's making the decisions and that you are there as a support and to help lend some structure perhaps to how you work with a person to clear space. I like to talk about some of the, I call it coaching, because in a helping role, you take the role of a coach perhaps. When it's possible, teaming with a trained helper or a clinician is useful, helping people stay focused on the task ahead, providing emotional support, being a cheerleader, help with hauling, taking things out of the home that have been let go of, and accompanying the person to practice non-acquiring trips is also a helpful role that a coach can take. Some of the don'ts are to avoid arguing of what to get rid of or what not to acquire. Taking over decision making is also very counterproductive. Moving or touching things that belong to the person without their permission, making assumptions about how the person may be feeling. And in terms of self-care, pushing yourself beyond your own tolerance. We know that when we're frustrated and tired, it's very hard to be empathetic and to maintain motivation when you're doing the work to help someone. This is just a list of some of the questions that we might ask as we're sorting items. And it's useful to have this list or other questions at hand that can guide the decision-making process and also help a person build strength around decision-making as a skill. And of course, there are questions related to challenging acquisition. So if you're out with someone practicing not acquiring, these are some of the questions that you could perhaps use to help someone make different and more informed decisions about their acquisition. So in preventing relapse, there are a number of things that need to happen. One is a review of the skills that the person is learning to reduce cluttering and hoarding, to maintain those skills by identifying strategies to help, some of which I talked about today, but connecting with a clinician or another trained professional to plan for some support from them, as well as some booster sessions that may help you and the person in your work together, and then scheduling practice for non-acquiring and discarding. So making this a regular undertaking and not just making it a one-time event, because we know that things will not remain the same if we're not consistently attending to working on new skills and working on decluttering. So lastly, some of the community-based hoarding resources, the cognitive behavioral treatment I talked about earlier, and the mental health clinical treatment is one part of it. There are many other aspects that may play a role in helping with a hoarding or clutter problem. This is a list, if you delve into some of the research that's happening about various aspects of treatment. So family-based models, peer-assisted interventions, harm reduction, as I mentioned earlier. These are all interesting approaches and evidence-based research that show that there are ways to help and to make meaningful change. If you think about your community, there are different approaches to intervention. I mentioned some of them earlier. Some communities also have what's called hoarding task forces or response teams, which are made up of municipal providers, and they can be people from public health, mental health, first responders who often come into a home if there's an emergency and may be the first to note a hoarding concern. Senior centers, councils on aging, town nurses, informed professional organizers, and so on. These can all be people who can provide support and can be members of hoarding task forces within the community to help provide support to those who may be cluttering or hoarding and they're the people that care about them. And referral options, I've listed a number of websites here that you may take a look at. So there are support groups and a list of mental health and family therapists. There are, as I said, informed professional organizers who have education about hoarding. So you may look at the professional organizers for chronic disorganization. There are a number of sites to look into and to take a look at based on your specific concern. And I know I went through a lot of slides today. I appreciate your patience, and I will be sharing my resources with Mental Health of America and with Jackie. And thank you very much for your time. And I will
Thank
stop
you so much.
sharing my slides.
Perfect. Thank you. Thank you. I am going to now hand it over to Elizabeth. Just a reminder, everyone, that all of the slides and things shared will be sent out afterwards. So I know a lot of you are eager to have those in your hands. Those will be shared. But welcome, Elizabeth. I'll hand it over to you to continue for our second half of our time together today.
Thank you so much, Jackie, and thank you, Suzanne. That was awesome. Okay, so here is my slideshow. Again, I have lived experience with hoarding disorder myself, and I have family members with hoarding behavior. I do one-to-one peer counseling. I am a presenter. I facilitate buried in treasures classes, which Suzanne mentioned. And this is an application of cognitive behavioral therapy as applied to hoarding issues. I conduct an advanced drop-in group that's an ongoing group that underscores the skills that were taught in Buried in Treasures. I am co-facilitator for an adult children of people with hoarding disorder, because we definitely have found that the children of people with hoarding issues have very special and unique needs. We also conduct a group for family and friends support group that could be spouses, siblings, etc. I'm a peer counselor at the Mental Health Association of San Francisco, and there's my email address. I have a colleague in the room, and I'm hoping she will put my email address into the chat room again later as well. So how did I get so many objects? Active acquiring. So this is when I have consciously made the decision to bring in more objects, either free things or going to garage sales, thrift stores, etc. Passive acquiring. This might be packaging from a TV dinner or junk mail or inheritance or gifts where I did not consciously per se add the item into my collection. A big one for me and for many of us is avoidance, where the anxiety that is produced from trying to make a decision about whether to keep or discard the object can be so profound that it's just easier to not make a decision. But not making a decision is a decision in itself. I am a woman of a certain age, and after a lifetime of avoiding making decisions, I now have a sizable collection. And then poor organizational skills. I just somehow didn't learn that lesson in kindergarten, put like with like, etc. So Suzanne showed actually this very same slide. This was produced by Dr. Randy Frost, and he took a bunch of grad students and from Boston University, the same school I built, no, Smith University, I'm sorry. And they took an empty apartment and they gradually filled up the apartment with each room, like this is the living room. So they filled up the rooms with more and more objects. This number one, it looks pretty clear and it looks somewhat like a hotel room. Please notice the window as it becomes increasingly full of objects, so that when you get to number 9, the window is basically completely covered up. And when you think about if there's a fire going on and a firefighter needs to break that window down, how is the firefighter going to come into the room and hopefully save the individual inside the room? So in point of fact, a lot of times people with hoarding behaviors, they might organize their rooms a little bit differently. They tend to put things in boxes and then they stack the boxes up on the sides of the room, and then the room becomes more and more narrow. But a picture, again, is worth 1,000 words. So I want you to take a special look at number 7 here, maybe 6, 7, possibly 8. And this is what my space looked like before and after. This is the dining room. And I think if you could see the other view, it was probably a 6 or 7 or 8, somewhere in there. This is what it looks like now. I happen to be sitting in this room right behind me, right here. You can't see it right now, but that is this cabinet, and I'm sitting here. So I've come a long way, hooray, hooray. Here is my before and after photograph of my bedroom. This is the bed. This is the same bedspread that I have in this shot. Here's the dresser. And this is probably, I don't know, probably a 5, maybe a 6. And this is what it looks like now. Yes, it's a kind of a small bedroom, and maybe I could remove more furniture so there's more clear space around the bed. I appreciate all those hearts and clapping. Thank you. Yeah, it took me quite a while. Thank you for the support. I appreciate it. And here's my office / guest room before, and behind this coat rack, there's a bunch of more stuff. And this is what it looks like now. In fact, I have a house guest right now. My sister is staying on this bed and visiting me, which I didn't have anybody in my home for 10 years, because of a number of items that I had in my home. This is my entryway. This first photograph looks a little strange because I'm taking the photograph through glass, but these sheets, this is a sheet and this is a sheet. These are stacks of boxes, and I've tried to make it look more attractive by putting these sheets over it. And this is what it looks like after. This is my, I live in a large place, so I'm extremely fortunate in that regard. And I have an in-law apartment downstairs in the house that I live in. And this is what it looked like before. And I now have cleared it out, and now I'm renting it out, and I have a subtenant, which is helping me to defer the costs for my general budget. So instead, and in addition to all of these materials that I had, I rented 2 storage units in addition to this big house that I lived in, and the backyard was full of stuff. So now instead of paying storage for my stuff, I have cleared the stuff away, and I'm now, my home is generating income instead of just supporting my collection. And here is the in-law apartment bedroom before and after. This is for example, this is a push lawn mower right here in the front. And so far I have released about 900, well, I've released 966 banker's boxes worth of stuff. I still have, actually, the garage is still an area that I need to go through, and I have one other room to go through. And then I'm done. Now, if I were to take this bed and chop it up into a bunch of different boxes, how many banker's boxes would it fit? It would probably be 10 banker's boxes, something like that. So yay. So how did I do this? I didn't do it by myself, I can tell you that much. And one great tool that I did was I used bookending, and we call, text, email, or Zoom our clutter buddy before and after taking a difficult step in our recovery. Thus, we hold ourselves accountable for completing a specific task or project. We also learn how long it takes to complete a given task. Now, this particular tool, as far as I can tell, was invented or originated by Clutters Anonymous. And Clutters Anonymous, CLA, is a free. I love the word free. I have hoarding issues. I love free. They have free services where it's actually 24 hours a day, 365 days a year, where you can do bookending and talk to other people who have clutter issues and just touch base. And I find housework boring to this day. I get bored to tears with it, and it's emotional for me. So if I'm on the phone and I contact a clutter buddy and say, well, in the next half an hour, ring, ring, ring. Hi, Serena, or hi, Suzanne, it's Elizabeth. And in the next half an hour, I'm going to wash 4 dishes. I know I can do a SMART goal, specific, measurable, attainable, relevant, and time bound. I know that I can wash 4 dishes in a half an hour. What are you going to do, Suzanne? And Suzanne might say, well, great, Elizabeth, good luck with that. And in the next half an hour, I'm going to sweep my floor. And then we say, great, great. And then we hang up, and then we call each other back a half an hour later. And I might say, well, you know, Suzanne, it's Elizabeth. And I got on Facebook and got totally distracted. And Suzanne is not going to judge me or criticize me and just continue to support me. And then Suzanne might say, well, no worries, and good luck with your next half an hour. And she might say, well, in the last half an hour, I did, in fact, sweep my floor. And then I might say, well, I'm in the next half an hour, I really am going to wash those dishes. And then we just keep doing that. And that's fundamentally how I was able to clear my space between the support that I received in cognitive behavioral therapy through the support groups at the agency that I now work for, the Mental Health Association of San Francisco. And we do provide all kinds of free services for California residents. And again, I'll put my email address into the chat room. So between well, that is certainly one place where I got a lot of help, and I do recommend Clutters Anonymous. And here are some other places that people can do bookending. Debtors Anonymous, which provides free emotional support for decluttering and non-acquiring to help help minimize that urge to acquire, because that cycle that we need to break is bringing items in, bring them in, bring it in, bring it in, and then stack it up and not release it. Debtors Anonymous, also free. Under Earners Anonymous, also free. Clutters Anonymous, also free. And these are modeled after 12-step program like Alcoholics Anonymous. So it might not be everybody's cup of tea. It is spiritual based. It's not religious, but it is spiritually based. So you can take what you want and leave the rest. And you can do the bookending regardless of how you feel about whatever else they're offering, whatever meetings, their sponsorship, doing the steps, etc. I too want to recommend the International Obsessive Compulsive Disorder Foundation, the IOCDF website, which lists a wide range of services. And I'm mentioning all of these things because it's a long haul to declutter. It takes a lot of effort and it's extremely expensive. If I were to have hired a professional organizer and I was relying solely on that professional organizer to assist me, or a clinician, it would have been enormously expensive and taken me a long time. It took me a long time anyway. But at least with a community of people in these various support groups, it can be extremely helpful. And it also makes me feel, it helps me step out of the isolation and the shame and the embarrassment. And it's helpful to learn that people and relationships are more important than my lifeless, inanimate objects, because people kind of scared me. I had a lot of trauma in my life and I clung to the objects rather than reached out to people. And Suzanne already mentioned this, but there's a wonderful book out my bar here, I can't quite read it myself, but it's Buried in Treasures. Buried in Treasures, Help for Compulsive Acquiring, Saving, and Hoarding. Second edition by David Tolan, Randy Frost, and Gail Stadecki. And that provides a layman's terms on cognitive behavioral therapy. I highly, highly recommend it. And from that, people can conduct Buried in Treasures groups, as my agency does. And again, our agency provides lots of free services for California residents. And you can find our services, the Mental Health Association of San Francisco and Peers in Oakland, California. They do a free Buried in Treasures group. The Rodriguez Lab at Stanford University, they have a free Buried in Treasures. I really urge you to Google your area, your district, your region, and see if there aren't, maybe there's a task force on hoarding disorder that's offering a Buried in Treasures group. That can be very, very helpful. And if there is no groups near you, the Buried in Treasures group that I really like is Mutual Support LLC in Boston, Massachusetts. And it's extremely reasonably priced at $250 for, let's see, 32 hours worth of support. Now, I do have an exercise from Buried in Treasures, but due to the timing, we have 10 minutes left. I'm going to skip this, this cognitive behavioral therapy question, which is, what is likely to happen if I work on my hoarding and cluttering issue? Well, if you pose that question to people who have hoarding issue, they might say, well, I might be able to entertain, or I can save myself from eviction, or I can get my family off my back. And then you can pose the question to the individual, what is likely to happen if I don't work on my hoarding and cluttering issue? Well, I could be evicted. I won't be able to find things when I need them. I'll continue to spend money that is beyond my budget, and my family will still be upset with me. but sometimes they'll turn this around and say, what is likely to happen if I work on my hoarding issue? Well, if I let go of my objects, I'll be depressed. And that's a valid concern. So that would have been the exercise that I would have run folks through, but I do want to conclude my presentation so we have time for Q&A. So if you have any more questions here, this will be part of the PowerPoint that you will see, and it'll have this information in it. And thank you so much for hearing me out. And I pass.
Thank you so much, Elizabeth. We so appreciate you being here and sharing your personal story and your experience. And I know so many people, you might not have been keeping an eye on the chat, but we're sending outpouring admiration and support for you. And we just appreciate your willingness and vulnerability to share that with all of us, because it is a great testament to the statement that recovery is available and it is possible. And you're just such a great example of that. And it doesn't come without dedication and hard work and challenges and setbacks. So it's great to see where you have come today. I know we have just a few minutes left of our presentation. And thank you all for asking your questions. A lot of your questions are answered by certain resources and things that we'll send out that were included in the presentation. So keep an eye out for those in the next few weeks. But I would love to just do a couple questions with our speakers. And one that I really wanted to pose that I saw that came through that I think a lot of people on this call could benefit from you speaking a little bit more on. And really, Elizabeth or Suzanne, feel free to share on this question. But someone had shared that they recently lost a family member and have a lot of boxes of things of that person's that they feel like they can't let go. But they just keep adding it to a room and it keeps getting bigger and bigger and they're not sure how to get motivated to clean it. And any advice on this? And I think it brings up a good point in general too, of just that motivation and how to really start and what works best to have that first step. Go ahead, Elizabeth.
Yeah, I would like to take this one. My husband died in a very tragic way. He had hoarding behavior as well, and I had tremendous attachment. Buried in Treasures, they call it unhelpful beliefs about attachment, clinging to the objects. And I got this idea, well, I want to honor my husband. So somehow by hanging on to the objects, I can kind of keep him alive. But the reality of it is I decided that wherever my husband is, he would want me to live a happy and joyous life. He would want me to live a good life. And that living a good life, even though these objects were precious to him at the time of his life, they were not useful for me in my life. And that my husband would really prefer if I cast those items, like bread on the water, and send them out to people who would benefit from those objects instead of me hanging on to it. And when I took that approach and let go of the objects, I felt a lot better. Now, I haven't let go of all the things. I sort of have a little bit of a shrine going on to my husband, but it's a manageable room, although I still have some of his things that I haven't let go of that I need to. But good luck with that. And grief groups are wonderful. Bereavement groups can be very, very helpful. It's hard losing anybody that we care about. Thank you, and I pass.
I would just add, Elizabeth, I think you've done some amazing work. And I think your example that you shared with us about your husband, and it really demonstrates the connection between important people in our life and our things and feelings that we have around our things related to our people. And your suggestion to attend to the grief and to perhaps do the work with the clinician, right? To work through some of those concerns is extremely important. I thank you for sharing your example.
Thank you both. I know we have a little bit of time. I'm going to sneak one more question into each of you. This question came and is regarding kind of the diagnosis or maybe lack of diagnosis of hoarding disorder. And someone had made a comment that they have heard that hoarding disorder is more prevalent among older folks. Is that accurate, or do we tend to be able to diagnose hoarding disorder once it's become that crisis stage, and that has taken more time to identify in an individual's life? And really just and this might be a Suzanne question of how do we start to identify and diagnose and get support in earlier?
Sure, it's a great question. And I think earlier in the deck, I showed a prevalence of onset or age of onset at about age 11 to 15, but younger kids and teenagers don't have the accumulation of things that we have over a lifetime. And so people, when they get into middle age and older, tend to have more stuff and may live alone and may not share space with others who may be regulating the amount of things in the space. So I think what's particularly interesting in research right now is looking at hoarding behavior in children. We don't have an abundance of research there, but it is an up and coming area. So I'm interested to learn more about that. One thing that I do know is that folks tend to seek help in their later 50s and older, and that women tend to reach out more than men, although the research indicates that more men may experience hoarding disorder than women. So it's kind of an interesting aspect to that. Most of the folks who participate in my treatment groups or in my peer groups are 50s and 60s and older. So that's something that we see in terms of people seeking help.
Yeah, definitely. Thank you for that. And I know there have been multiple questions in the chat, and thank you, Elizabeth, for responding to some of those, but multiple questions throughout today's presentation of if the information from Suzanne's section is also applicable to animal hoarding and what that looks like, or if there are specific resources that individuals can share with someone in their life that might be animal hoarding.
Yes, that's a great question. And given the time, I know I went a little over on my time on my portion. I apologize. I did have some information about animal hoarding. Tufts University, Tufts Veterinary School is an excellent resource. They've done a lot of research in that area. So if you are Googling about animal hoarding, adding Tufts Veterinary School to your search is helpful. But there are some really interesting aspects of animal hoarding. It's not as predominant as hoarding disorder. But it is something that is important, and I think doing a search with those criteria will help.
Definitely. And we'll be sure to include that in our follow-up materials for you all as well, so that those individuals who are interested in learning a little bit more about that can access those materials. But with that, I know we are close to our time at our hour today. I just want to say a big thank you to everyone who joined, and especially to our two wonderful speakers here today, Elizabeth and Suzanne. Thank you for sharing your knowledge, your wisdom, your experiences. I know that all of us on this call appreciated it so much. Thank you to everyone who joined in, who asked questions, who is engaged. And just a reminder, we'll be sending out these materials and resources within the week, and look forward to connecting with you more throughout Mental Health Month this May. Thank you, everyone. Thank you, Suzanne and Elizabeth. Have a wonderful rest of your afternoon, everyone.
Thank you so much, everybody. Glad you were all here. Appreciate it.
Thank you.
Thank you.